in those interviews, a lot of the times we think that we have to respond right away and say something very quickly. But one way you can gain composure and find time is have your notes and write them down and say, can you repeat that question? Or and then really jot down like three quick points. If you're talking about making coffee or something, okay, like filter, coffee type, creamer, and then speak. That gives yourself time to ground yourself before just spewing. That was something that I did in that interview to remain calm.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 29. Hi everyone, Omar Richinze. Thank you so much for joining me today. I appreciate you all a lot. Definitely subscribe, leave a like, leave a review, share this with a friend if you have not as yet. I definitely appreciate that, and it helps get this show out to more people. Let's get public out to the world. I'm excited for today's guest. It's my first guest who is going to talk about her health administration health administration job path, and how her fellowship really catapulted her career and allowed her to get where she is today. And she is really pushing to help other millennial women in healthcare leadership. So definitely tune into this episode. There are a lot of gems, a lot of great insights. So without further ado, here's today's episode. Today, we have a healthcare administration leader with over 12 years of healthcare experience. She's experienced in strategy consulting, hospital and clinical operations. She has a bachelor's of science in biology from Santa Clara University and got her master of public health at San Francisco State University. After her MPH, she was accepted into a healthcare administration fellowship, which changed her career pathway from going to medical school to continuing her journey as a fearless healthcare leader. She's helping millennial women in healthcare administration find fulfillment in their careers. You can find her on Instagram at Jaennika.James. We have Jaennika A. James, MPH. Welcome to the show, Jaennika.
Thank you so much, Omari, for having me on the show. Super excited we're connected.
Yeah, me too. And I think this is my first health administration episode too. So I'm very excited to get your insights here.
Awesome.
Yeah. So how are you doing and just been coping through and everything?
Yeah, so I'm in California. So California had our threshold, if the ICU beds hit 50% over that capacity, they would shut us down. And it was by region. And then this weekend, our Bay Area decided to just shut us down, even though we aren't at capacity. So this whole week at work has been really stressful, and having to navigate those feelings with the staff, and then still not knowing, what this means for us and how this is going to affect our patients and our centers. It's been stressful, but I think this weekend I really prioritized cleaning, because for me, cleaning is therapeutic. And if my environment is clean, all my clothes are hung, things like that, I feel just a little bit more prepared. That's something I can control versus everything outside that we can't control. So that's been how I've been coping lately through this time.
Yeah, well, thanks for sharing. And I definitely share that sentiment of cleaning and just making things look nice, because you can't handle that right now. And I feel like I just work better when things are clean and not many things there, you know what I mean?
Yeah.
So how do you identify, and then tell us a little bit about your personal background?
Yeah. So I identify as a Filipino American woman. I am professionally, I identify as a millennial healthcare leader, and, continuously evolving, continuously growing in my role. Um, Personally, I identify as someone who just is figuring it out. I love fitness, and I love wellness. Um, one of my biggest things is I love being, quote, what they call extra. So you can see I'm like part, professional on the top and then, sweats on the bottom. But that's just, kind of me in a nutshell. My overall journey, though, I am in the Bay Area of California. So right now I live in the burbs, but I'm about 20 minutes from Oakland and about 40 minutes from San Francisco. And I grew up, though, in the Central Valley of California. So it's a small rural town. In California, right dead smack middle. There's really nothing there. I didn't really realize I lived in a food desert until I learned that in grad school. And so, there was only one clinic in town, and the nearest hospital is 20 minutes away, which is where my mom worked as a nurse. And my overall background, right, growing up as a Filipino American, you pretty much just have two career options that you are kind of socialized into. You can either be a nurse or a doctor. My mom was already a nurse. I'm like, okay, let me do the doctor route. And I ended up doing everything to go to medical school, as I know that you had too, right? That medical school dream of when you want to be in healthcare, that's kind of the only thing that you think about.
Mhm.
And from volunteering, I was a medical assistant at the local surgery clinic in town. Then I did my bachelor's in biology, doing all of the coursework there. I actually went to two undergrads. One was in Marin County here in the Bay Area. It was a smaller school, Dominican University of California, and I wanted a larger school, so I transferred to another private university at Santa Clara. Finished my undergrad there. After that, I landed a healthcare internship um, in public health, which was perfect because I was in that, quote, gap year of applying to medical school and I needed some money. And so this internship was 10 weeks, and I did that. That was my first exposure to public health. I had no clue really what it was because all of my courses in undergrad were all geared towards biology.
Mhm.
Uh, all of that hard science. And I think I just took one general public health class, but it was barely just touching the surface. Um, but it was really then once was more educated for my undergrad and then moved back home into the rural town that I lived in, I'm like, wow, this is, I was living in a bubble, but our community is a rural community, and we don't have access to a lot of things that I had at my fingertips living in the Bay Area. One of the biggest things that really just opened my eyes was when I was volunteering at a clinic. There was just this 90-year-old man who was just coming in for arthritis and just a checkup, whereas my grandma has already passed away at 80 with kidney failure, diabetes, and this gentleman was just so healthy, and it just kind of the different zip codes, the areas, and just access to help was huge for me. Got rejected. In the meantime, I was getting rejected to all of the medical schools that I applied to. I laugh now, but it wasn't pretty then at all. And obviously the pressure from my mom, because they don't understand, what we have to do, the money, the applications, the interviews. They just want to know that you get in. So I didn't get in. I ended up landing a job with that internship that I started at after undergrad. Um, and so I went in to go for my master's in public health, and I was like, this is going to get me into medical school. I hear that if you get your master's, you're a better candidate. I'm just going to do public health. That ended up being just a whole passion of mine that I just didn't recognize. And I mastered in community health education at San Francisco State University. Our program was rooted in social justice. Our projects and our community-based assessments were in the public housing homes out here in San Francisco. We got to, interact with all the San Francisco policymakers. It was just an amazing experience. But I was still studying for that MCAT. Um, I don't know if you studied for the old MCAT. Do you remember that one? It was like
I
4.
think the year that I took the MCAT, it just changed.
Okay.
Yeah.
Yeah. So I took the old one and then I had to study for the 8-hour one.
Hmm.
So I did that and I applied to medical schools. In that time, I ended up getting a internship at a large healthcare organization here on the West Coast, and it was the Equitable Healthcare Outcomes internship. Um, from then, I'm just kind of going very high level. If you want to, ask questions on that.
Oh no, I'm letting you finish, and then I'll dig into
Okay,
everything that I have to
perfect.
ask.
Yeah, I went into the healthcare internship, which then went into the fellowship, and then went into consulting and management now. So um, I did still get into medical school. I did get into 2 California medical schools, and it was at a time where I was in the fellowship, the last rung of it, where leadership is developing you into this leader, and it was either I continue on or go to medical school. And at that time, I went on to healthcare administration. It was a tough decision, but I followed my gut, and I knew my mom would always forgive me. I don't know if corporate healthcare leadership would, given the opportunity. So I took it, and Omari, I swear I've never looked back since. And here I am today. So.
Okay, well, I'm glad to hear that, and thank you for sharing the entire backstory of your life and your pathway there. And I'm glad that we get to dive into everything. So before we jump in, what does public health mean to you?
Yeah. I love this question. And I think really for me, it means systems level thinking. Um, I feel like even now more than ever, we've just recognized how, lack of better words, messed up or disenfranchised our healthcare systems are. And so public health to me as a professional means to take a step back and look at high level how what we are doing, what we are eating, what we are thinking impacts our overall health, and not even just systems within a certain medical center, but how that medical center might impact the community or the churches or the government, and then even our own systems, our family systems. How does that impact our health? How does the zip codes that we live in impact our health? So I think for me, public health is how do we as professionals exercise systems level thinking in a large way, um, which in then turns to how we impact populations and communities.
Okay, yeah, and I like that a lot. So, um, you got your associates at Dominican University of California. What was this associates for, and then what was your thought process in like going for this associates, knowing that you wanted to become either a doctor or a nurse? I'm guessing a doctor. You said earlier.
Yeah, so that was my first college that I went to, and again, this goes back to my own access to college. I didn't go to a college preparatory school. I had maybe 2 AP classes for the high school that I went to, and I didn't really know how to pick a college. Um, what I picked it on was that I was close to family and that they could be there for me. And so when I got to that university, it's a really good school. It just wasn't the right fit for me. And so I went into there with my still going into biology. Um, Met some of my best friends from those 2 years that are there. So one of them was my maid of honor at my wedding. Other one was a bridesmaid. So it wasn't wasted time there. But that's kind of where I went to Dominican, was just I didn't really know the knowledge of the college application process, and decided to do something small and close to family if I was leaving home.
Okay, yeah, and definitely that's fair enough. I feel like I didn't know much about college on only apart from what like my counselor told me, and I realized that I could have done a lot of things differently as I went through the system and actually learned about college. Yeah, but I guess that's how it goes sometimes, and hopefully like these shows and the information and access to that information will be easier accessible to people out there. So then after this 2 years, you transferred over to get your bachelor's of science in biology from Santa Clara University. So why did you transfer over to this school in particular?
Yeah, so it's easier to transfer from a private university to another private university. And I didn't want to waste those classes that I took, all those biology classes, all those hours put into lab. And so, fortunately, it was an easy transfer there. And then the school was a little bit larger, and that's what I wanted. Um, but it was tough because I felt as though going to another private university, I was having kind of this inferiority complex that I wasn't good enough. All of these people who had been there came from very high level college prep schools, and so navigating that was very tough. But again, found amazing friends there and was able to power through Santa Clara, and amazing resources. I think that's what I was looking for at that school.
Okay. Um, and could you name like some of those resources that intrigued you, or I guess intrigued you?
Yeah, I think it was the overall closeness to Santa Clara is right in the Silicon Valley. So they just had a lot of the different healthcare systems there as far as job opportunities. There was just a larger alumni group, stronger career center, um, and and also they were just evolving as far as their biology program. And that was another thing that again, my focus was on medical school. So I was like, oh, I heard a lot of people who go to Santa Clara get into medical school, so I want to go there. So that's kind of what I remember at that time my mindset was.
Okay, thank you for sharing that.
Mhm.
So your first position while you were doing your bachelor's was your research assistant at Santa Clara University. So how did you come across this position, and what kind of research did you do?
Yeah, so this one, I just wanted to find, in full transparency, find some extra side money that I can have while I was in school. Um, because I was slowly turning 21. I wanted some money to go to the bars, so my mom wasn't going to give me that. So I think in there I went into the career website, and they have like I forget what they're called, about like the work study programs
Mhm.
for college students. And then there was just all of the professors just post, oh, research assistant needed. And this one was with Professor Nichols, and she was actually a sociology professor. And I was doing qualitative research, first time ever doing qualitative research, and just reading. And she taught me the principles, so I thought that was really cool, of how to find themes within interviews. And it was really looking at the work-life balance for Santa Clara University professors. And so I was able to read them through, highlight themes, and then gather all my insights and provide that to her so she can put it in her paper.
Okay, that sounds like a pretty cool experience. And then
Mhm.
after that, you were a youth empowerment program director. So
Mhm.
how did you get this role, and what did you do in it?
Yeah, again, like going back to the resources. So you know how there's all the different college clubs on campus. And so for me, I was part of the Multicultural Center, and it's where, all of the different cultural clubs collaborate with one another. And given my experience with education and how I was unsure of the college experience, I wanted to take over the youth empowerment program, which is essentially building a team of volunteers that would then reach out to underprivileged or first generation students in the Bay Area to come and do school interview or school tours at our campus. And so it was really cool being able to coordinate days where I coordinated with the different professors and I had a team of volunteers. If I didn't do it, they were able to go tour the kids and provide them hope that they can come to a school like this and provide them those resources way early on. Versus what I had experienced going into college and then figuring out, ooh, this isn't the right fit. So it was so cool. And in that opportunity, I was able to coordinate with my high school back home.
Mhm.
And I brought them to the university, and then they did a tour because they did Santa Clara and then they did Stanford kind of all at that same weekend, that same day.
Yeah, that is really awesome because I feel like it's just exposure, you know. You need to have exposure in these kinds of places, and you have to see people that look like you in these places. And when you are exposed to that, you're like, oh, I can do that, and you might start to think more about doing those things. That's awesome, and that's great that you're able to do it for your high school as well. So kudos to you.
Yeah, thank you.
So you got your master's of public health at San Francisco State University right after, but when throughout your bachelor's did you know about public health, or was it just like, okay, I know people are doing the MPHs and going to med school afterwards, so I'm gonna do that? Like, what was the thought process for finding out about public health and then choosing it to do your MPH?
Yeah, I think the first time I found out about it was um, when I was actually looking for job opportunities after undergrad. And there was this thing called Health Careers Connection. And it's actually a program that's nationwide. So for any, new grads, or either if you're a junior or senior, you can do it. And um, from there, that was my first exposure to it. I had taken one public health course my senior year, and that's when they were just starting their public health program at the university. Still, then I was still laser focused on medical school, but it wasn't until I'd say that internship, because that exposes you to all of the different careers. It's not even just the internship itself, but they had you go like on certain weekends or certain days. You'd collaborate with all the other interns and learn what they're doing. And then that's when I saw, oh, there's all these different jobs in healthcare. And what is public health? And so that was my first exposure to it then.
Okay, awesome. And then talk us through why you applied to San Francisco University to do your MPH. Before that, did you take your MCAT and apply for med school after your undergrad, or did you wait until during your MPH to do that?
I applied twice, yeah. So I did right after undergrad, and then I waited until my second year in my master's program to do the application process again.
Okay, okay, no, okay, thank you. So what was your concentration, and then tell us a little bit about your experience at San Francisco State University.
So I was looking so at that time I was working as an outreach coordinator back home, and it was a small nonprofit. And I knew, I was like, okay, I went to a private university. I'd like to go to a public university this time. And I was also looking I'm a hustler. So I always like to work while I'm in school, because it's hard for me to not have some type of money.
Mhm.
So I looked for a program very specifically that allowed me to work while I was in school. So San Francisco State was that perfect merge. I didn't have to take on a whole nother ton of loans. And the program is designed for everything is evening, but in person. There's only one day on Thursdays that you have to go in. And so for me, the way I chose was what I needed professionally and also personally. Um, so from there, the program was 2 years, which is what I could totally do. And then I found a job on Craigslist as I kid you not, as a medical assistant. I was working as a, what is it called, um, patient service representative at this high end orthopedic and sports clinic in San Francisco. And some of these athletes are coming in from San Francisco Ballet, the Oakland A's. Some of these doctors did the Warriors. And so I was like, this is cool, get side money, still medical school in the background. So I'm like, I'm in a clinic setting. And because it was a private setting, they let me do some medical assistant work. I was doing like making all the injections and stuff. And then I would work that Monday, Wednesday, Friday, go to school Tuesday, Thursday. So that was a personal decision as to why I chose there, but it was the best decision. Again, found amazing students, and I was wanting a program that was really rooted in something that would challenge me. Um, this way, it challenged me being rooted in social justice. And I didn't know what that really even meant until the program, and being around students who, I grew up in the Central Valley, which is known to be a little bit more moderately conservative, and they were really challenging my perspective and challenging my views. And I feel like that's where a lot of my learning and growings came, was from them. Yes, the coursework, but also from my cohort. And it was a small cohort too. That was another draw that brought me to the program. I wanted to be very close with the people. There was maybe about 20 of us going through that program for 2 years. We were, so close by the end of it. And I loved the fact that, as I kind of mentioned earlier before, we got to do community-based health assessments in the community, real time. It wasn't just talking about it or learning about it, but as a cohort, we did that. And that was part of the graduation requirements for that program. So it was very rooted in social justice, very rooted in community health education, which was something that naturally I was very passionate about, given, again, my education story and those not having access to higher education.
Yeah, well, that is awesome. That's cool that you found a school that let you balance that school balance, and they really created that opportunity for you to do that, as well as having that small cohort where you were able to really bond with students. And that's awesome that you all do like a cohort community health assessment. That is definitely something valuable. And I don't know, like I don't think I've ever heard anyone else ever say that before, that they've done a cohort community health assessment. So I bet that has a lot of insights that you gain from that, just from being part of that. So that is awesome.
Yeah, and in that, Omar, I want to share, in that community-based assessment, what we did was we went to the San Francisco public housing, because, as you know, gentrification is huge, especially in these, urban places, and the tech industry coming in. Um, and what we did was just, we were trying to understand, is art a form of healing for people in these communities?
Mhm.
And so we were interviewing some of the residents, some of the people that were overseeing like the affordable housing places, some of the artists in the community, which was so cool, that we got to interview. And then from those findings, we were able to present it to the policymakers, and they were able to install like pieces of art in, or art programs into those housing units, so that was their additional form of healing. Um, so
Oh,
it's
that
really cool.
Yeah, that is really awesome, and I feel like that is something that is misplaced, like art being a part of health and healing. I think there's so much healing and like mindfulness and stuff that you can get from art, and I'm glad that you all use that throughout your project. That's awesome. So another position you had during your MPH was a research intern at Minority Training Program. So what did you do in this position?
Yeah, that was a super cool opportunity. For people in grad school right now, it's like the opportunities come, but you also have to go and grab them and look for them. And so this was with UCSF, and it was called the Minority Training Program in Cancer Control Research. And I think a lot of success I found was finding those programs that go for first generation students, underprivileged, because that is my background.
Mhm.
And in that, it was really focused again on a cohort. It was like a 5-week um, cohort where we got to learn from all the researchers. And if you were lucky enough to get placed into an internship, you had the internship along. It was a program and then also an internship. And in that, I was able to do community-based participatory research on African American communities on biospecimen research. And that was my first time doing that in that setting, in real data from a principal investigator. And so that was so cool, being able to understand how to do that, learn about the community, the amount of distrust that has happened because of the Tuskegee experiment, and also the story of Henrietta Lacks. And so, there's a huge amount of distrust in the medical community for because of the historical background, and that was one of the biggest insights I learned in being able to practice CVPR for the first time.
Yeah, that's awesome. And then you had another research assistant position, or a research assistant position at University of California, San Francisco.
Mhm.
So how did you come across this position, and what did you do in this one?
Yes. So one thing I always give advice on is, like, once you got one foot in the door, get that other foot in, get that other toe in. And so while I was interning as for that minority training program, I was asking for what other positions are there. And so there was another principal investigator separate from this project who needed some assistance. And this was more kind of like end note cleaning up or coordination of meetings, just helping her on the administrative stuff, and still getting that research experience by being alongside her and her team and learning all of the literature there. This one was also about biospecimen research as well as ethics on that, and just kind of dusting out the cobwebs. I remember it was about coordination with Mayo Clinic and UCSF on pancreatic cancer, because it's so aggressive, and how people would want, if they were um, I forget, but if they had the choice to know based on their genetics that they had that gene, would they want to know or not? And because some people do, same thing with breast cancer, some people want to know if they have the BRCA gene or not. And so it was that was where that research focus was on. With all the technology, do patients want to know if they have that? What is the ethics behind if they don't want to know? But as the provider, do you tell them? So I thought that was really cool too.
Yeah, that is fascinating. And it's cool that you're doing research on what people think about that, because I feel like the healthcare biogenomics technologies are increasing at a very high pace. If you look at CRISPR and all these different genomic splicing technologies, and it does beg the question, like, how much personalized medicine is too much, or like where do we um put that barrier and say, okay, this is invasive into human. But I think that will be a conversation coming in the next coming maybe months, years, as CRISPR and these other technologies are taken up and are used to cut out genomes and slices of DNA and whatever else is the case. But I don't know if you want to say anything about that, or if you have any experience with that kind of research or anything around that.
I think pretty much what I said was, what I had experience on. It was very entry level, and at that time, it was so huge for me. I had no idea what it all meant. So a lot of the times, I was Googling, "What is this gene?" Or
Mhm.
Um, so I mean, it is right. Personalized medicine is so exciting, where you get to know all the ins and outs of, it's like almost predicting the future, right? But then there's people who also just kind of want to live their lives and let things happen to them, or instead of, being too personalized where, because maybe you do have the gene and you don't get it.
Mhm.
um, so it's just, again, finding that balance, um, with the information that we have now at our fingertips.
Yeah, absolutely. And there's going to be that, I guess, a fight for balance going forward. So you got this role as an equitable care health outcomes master levels intern at the health. I was going to ask if it was during or after your MPH, but I guess it's during your MPH you got this internship. So talk to me, like how did you come across this internship at this big healthcare organization?
So this one was actually after.
Oh, was it?
Mm-hmm. Mm-hmm.
Okay, okay.
Yeah.
Cool.
Yeah, so I got this one. So I finished my MPH program, and I was just on Indeed.com and just looking for
Hold,
for
hold on. Before that, because you said that you applied to, or you redid your MCATs for a second time during your MPH program. Okay, so let's talk about doing your MCATs for the second time and choosing not to go to medical school. As
Okay.
yeah, like
Yeah, before I go to that.
yeah, what made you decide to do that?
Yeah, so starting January of that year, I was like, okay, let's do this. Let's get my MCATs done. I again went on Craigslist and I found a tutor, an MCAT tutor, who was also trying to make some side money. I'm telling you, in the Bay, we're all just hustling out there. And so he was in the process of applying to medical school and got into all these things, and he needed money. And so I'm like, I need help. So he helped me while I was studying, and in my last final like 6 months of my MPH program. It got to a point where I was a research assistant at UCSF, and I had to put in my 2 weeks because I was like, I can't do all of these things, finish off my MPH program, MCATs, applications, and work. So at that moment, I decided to give my 2 weeks, and I pulled out a personal loan to get me through the end of that year. Um, so yeah, I just was, applying for medical schools at the same time, did my MPH or my MCAT program, MCAT. And there's that whole gap year of when you're waiting. And so that's when I was like, well, let me just get an internship, because an internship is not permanent. You don't have those strings attached if it's a full-time job.
Mhm.
And so that's where I landed this internship
Okay.
um, first. And still then I had told people I was still applying to medical school. And then that is when, after, it was like only like a 3-month internship, I think, come October, they were opening this brand new healthcare operations fellowship program, hospital operations. And I'm like, oh my gosh, it's only 1 year. It's perfect for my gap year. I'm going to apply. And then I ended up getting it. And so that is when that switch towards medical school, still in the process of it, in parallel while I was doing the fellowship, because I was like, this is perfect. Once I get in, boom, done, I go off to medical school. And again, this thought of trying to control the timing of it. But we all know timing is sometimes your worst or your best um, ally. So that's kind of where that was.
Okay, awesome. Thank you for sharing that. So you got this internship. What did you do in this internship?
hmm So it was in the Equitable Care Health Outcomes Fellowship. So for this one, it was again using assessment on our quality leaders, on asking how we can leverage technology for, oh my goodness, I'm just like refreshing myself. I forget what the question was, but it was leveraging technology on our healthcare measures that we're working on. So like colorectal cancer, breast cancer screening, and how do we leverage that? So that was one project I was doing, helping the director just gather insights from all of the different healthcare leaders and doing interviews with them, and then gathering it into a slide deck and then presenting it alongside with her. So that was my project. Second project I was working on was in what they call an AIDET tool, AIDET tool for physicians. So they have, and it stands for acknowledge, introduce, I think duration, educate, and think. And they had a tool like that for the Latino population and the African American population, but I wanted to create one for the Filipino American population. That was one that there was a gap. So I basically used the two models that were there, and from my research back in my MPH program was able to develop that for that population. So it was really cool. It was a really cool project there.
Yeah, that definitely sounds like a really cool project, and I'm glad that you got to work on that. So talk me through like how you got the fellowship afterwards. Did you have to apply? There was like a special fellowship application process that you had to go through to get the fellowship that you got afterwards, or how did that go?
Mm-hmm. Yeah, so so at the end of my internship, again, foot in the door. So they allow you to do informational interviews while you're an intern. So at that time, it was like, okay, I'm going to do an informational interview, but I'm also going to give you my resume because, again, I'm a hustler. So I said, great to learn about you. This is about me too. Here's my resume. Do you have any job offers? So I did that for a couple people. There was one in like the research field. They offered me a job there. And then this brand new healthcare operations fellowship just opened up, and I did the same thing with the recruiter. I'm like, hey, I'm interested. Here's my resume. Let's go. Let's do this. And because it was a first year, they hadn't had anything built. The president of the organization was like, I just want to do this. They only chose from that year that cohort of summer master's level interns, which I qualified for. And the qualifications were you have to have your master's. And at that time, they were just focused internally on the interns who were already in-house. Again, timing is everything. And so in that interview process, I did interview one, and it was with like 5 people. All of these questions, towards me. Okay, like knock that one out. And like thinking about it gives me anxiety because I'm like, I've never had that before. And then second interview was with the president of the organization. And oh, Marky, I was wearing jeans that day. I was wearing jeans. It was called, a Thrive Thursday, where you can wear, casual clothes and a t-shirt and Vans. and sometimes naivety is key, because they teamed me and they said, are you able to interview? I was like, yeah, sure, I don't care, like that's fine. Then I looked at her on the thing and realized she's the president. I was so nervous, and at that time I was just praying to God. I was like, well, this is how I'm wearing today. I need to kill this interview. So I interviewed with her, and heart racing. That everybody had to warn her what I was wearing that day, and so that way they weren't alarmed. And then after, she's like, I thought it was really nice that you're wearing our company t-shirt. And I'm just like, I burned those pair of jeans after again. So I ended up getting it, and there were only 2 of us that year. And again, because it was the first year that they had done it, we were building the plane as we were flying. And so in that fellowship, I'm like, okay, well then I'm going to find the opportunities that I want to develop my skills in, because there's no really playbook. This is the first time. And so I just grabbed whatever someone needed. But they did place you with 2 mentors. And so from that, I had one mentor working on more delivery systems and like building of hospitals and expanding. And then I did one that was more operational and like workplace safety. So I had those two people to help guide me. And then I rotated out from the regional offices, which is kind of more corporate high level, down to the hospital setting. And so that's where I kind of did a rotation on performance improvement and lean and all of that. So that ended up working out.
Okay, that's awesome. And I think it goes like having that interview with the president and having everyone before like warn her that, okay, this is what Jaennika is wearing today. I feel like that kind of speaks well on your side, because those people are willing to go out their way to warn her, to say, okay, she may not look like what you expect her to look like today, but she is the person that you need. And as you said, you knew you were in that position and you knew you had to kill that interview, and you did as you did. I wanted to ask you a question, because you said you were in an interview where they had 5 people interviewing you.
Mhm.
So what's your thought process like going through that? What advice would you give to someone like trying to go through that kind of high intensity interview process?
And is you just have to breathe, because sometimes you forget to breathe. I remember, like, again, I get anxiety thinking about it because it is stress inducing. You've got
Mhm.
all these leaders and they're in their blazers. But I think the biggest thing there for me is, as I was prepping for it, it was like, okay, you get your resume and you need to make sure that you know everything that you wrote down on your resume, because they're going to be asking you. And knowing that when you go into those interviews, they might not ask you directly, what did you do as an outreach coordinator? But they might say, how did you problem solve in a very stressful time? That's when you can pull your experience. And then when you're interviewing with 5 people like that, um, my other suggestion too is, when they're going to ask you all these questions, give me examples, da 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 da. You don't want to give the same example over and over again, or the same work spot. Talk about what you did as a volunteer for, like, even if it's just like, oh, youth basketball, I led a team. They want to hear that stuff, and they want to hear the struggles, but not just the same example, but said differently every single time. So I would say the biggest thing is to prepare. Get your resume ready to go. Write a cover letter for yourself if they haven't already, and that was something that was required. They had specific questions that as to why I wanted to do the fellowship, so have that in your back pocket. And in those interviews, a lot of the times we think that we have to respond right away and say something very quickly. But one way you can gain composure and find time is have your notes and write them down and say, can you repeat that question? Or and then really jot down like 3 quick points. If you're talking about making coffee or something, okay, like filter, coffee type, creamer, and then speak. That gives yourself time to ground yourself before just spewing. That was something that I did in that interview to remain calm.
Yeah, and that is some great advice. So thank you for sharing that.
Mhm.
So you said that this fellowship just kind of came out of nowhere and you were able to choose which experiences or what skill sets you wanted to build on. So what was your thought process for choosing and what was your thought process for choosing which ones that you wanted to push out on in this process?
Yeah. So they knew that I was very community health based oriented, and so that was already from there. So I was like, whatever you guys have, I want to do. Um, I think what my thought process was I wanted to learn the business. I wanted to learn the operations. I don't know any of that. And I want to learn how leadership. I want to learn how to lead teams. And so that's when they put me in different trainings. Like they shipped us out to, there was 2 of us at the time, to the Institute of Health Improvement conference out in Florida. they had us do management training because that was something we were interested in. And they had us do diversity training as well. And then I also told them that I keep hearing this stuff about lean, you know? So that's when I wanted to do performance improvement work on how to get certified in that and what does that mean. Um, so those were some of those things that as I was in the space, I didn't know exactly what it was, but I said, well, um, let me learn alongside you on how to do that. Or even this term, hospital throughput. You know, that's something I didn't know because I don't have a healthcare administration master's. I had a community health education, which was all curriculum based, you know, community needs assessment. So everything administrative, business, knew nothing about. And I was like, that's what I want to learn.
Yeah, awesome. Um, so then after this fellowship, you got another fellowship, is that correct?
No, so after this one, I transitioned into a senior consultant role.
Okay.
Hmm.
So is this at the same organization?
Yes, same organization.
Okay, so how did that process look like?
Yeah, so the beautiful thing about the fellowships is that you kind of have a foot in, and I'd say like 2 months before your fellowship ends, you got to start looking for positions, looking for where you want to land, and for the most part, they will land you there. So you kind of have to do what they call like a whole year of hazing. I felt like in the fellowship because it was tough. You know, it wasn't, it's like an internship on steroids, I think is how I felt, and trying to prove yourself in that time. And so from then they're like, okay, here's your reward. Just they might not have the exact opportunity right away, so they allowed me to work as a fellow until a position came that they were able to slide me into.
Okay, awesome. What what do you think you really took away from your fellowship, saying that it was so intensive, or how did you cope with it being so intensive?
Yeah. Um, I mean, I really didn't at the time because, you know, as a new grad, you're just trying to prove yourself. Um, I think at the moment, for me personally, I learned how important it is to take care of my health because I had stress hives for the first time. My A1C was super high, and I started to really look into health wellness apps that can help me with my fitness, with my mindset, because I felt like I was giving more than I was giving to myself. Um, so I'd say that was the biggest thing. And I really realized then is if I want to go into healthcare leadership and healthcare administration, I need to take care of myself first and foremost, the best that I can, because it is a lot. It is a lot. Um, you know, things are never really ever closed. Hospitals are open 24/7, 365, you know, and that's what I learned very quickly in balancing the intensity and at the same time finding mentors for me in the fellowship that I can real talk with and say, oh my gosh, I just can't today, or you know, um help me through this because I want to quit. You know? So I think the mentorship and finding friends too.
Mhm.
As in my different rotations, I was able to find friends that were my age. And it's hard to find, especially kind of in healthcare, right? A lot of people right now. I think there's a lot of boomers and there's a lot of us as millennials, and so you know it's kind of hard when someone who you're with all the time has like 50 plus years of experience, and you're like, I don't know what to talk to you about. So finding friends too, so you can have lunch with them, and you know, um, have fun, like happy hours, things like that.
Okay, awesome. I don't know if you said what you did as a consultant or as a senior consultant in your role. So just touch on that.
Yeah, so in that role, I was able to support our chief operating officer at the hospital, whatever project she needed. I did as well as our hospital CEO, whatever he needed, I just did. So it's kind of like you're their project person. Um, so for that, like a couple things that I did there, where there's this Schwartz program for healthcare professionals, because a lot of the time because of the volume that we see every day, we can lose our compassion or lose our empathy.
Mhm.
And so it was launching that program at the hospital. I also helped implement some tools for our nurses, looking at staffing and productivity and teaching them that whatever finance reports. I told the CEO, I was like, I don't know anything about finance, so put me in things like that because I want to learn. So they had me sit with the finance department, and it was cleaning up Excel spreadsheets. It was really down and dirty work, but that's how you learn, you know. Um, and so I was only in that role for about um, 6 months until the management position came up.
Okay. And that position was manager administrative services.
Yes.
Um, so what did you do in this role?
Yeah. So in this role, I managed a small team in the hospital. So it's 24/7, 365. I had about um, 10 people, 7.5 FTEs. And these are the people in the hospital that go overhead, like code blue, code red. They're the ones, on the speakers overhead. And in that role, it was really cool because I learned all the back ends, like how the phones come in, what to do when there's emergencies, and how the code blues come in. So when someone's coding, all the back end stuff of how it launches on their screen and they press the button and they go out. It was really cool. And it was a lot of more like supportive services behind the scenes that people don't think of when you're in a hospital, right? There's all these little pieces that make that hospital run, and they're so important. We usually call them the heart of the hospital because they're the ones that know what to do, like especially for where I worked. I work close to Napa, so there's always those fires.
Mhm.
um, so when there's fires going on, you need a team of people to start to communicate and mass text all the administrators and let them know what's going on. How do we want to make announcements? How do we want to say something to those on site? So they are called the communication operators. So I manage them 24/7. The worst part was when they'd call me at 2 a.m. and say that the phones are down,
Mhm.
or that one of their staff people didn't show up to work. So that was tough. It was a tough role. In addition to that, they also put me in something what they call space planning. So I was overseeing a lot of the different, if a doctor is moving into one office, where do we put them there?
Mhm.
Reconstructing different areas of the clinic or the hospital, what that process is there. Again, systems level thinking of how, from the actual physical standpoint of a clinic or a hospital is built, and things to consider and who goes where. I was also overseeing that.
Yeah, that sounds pretty cool. And then after this role, you became the manager of health education. So was this a promotion, a shift, and how did that all work out?
Yeah, so it was a lateral move, so manager to manager.
Mhm.
I think the big shift there was, I didn't want to work 24/7. I learned that quick. I don't feel like I do, because as management, you're always on. Like there's no like cut off at 5. Like I still always have my phone on me. Um, but it worked out perfectly because our leadership changes, and it was still in the same company, same location, just different clinic, just 30 minutes down the road. And that is like I felt more equipped to be able to take this role because of my operational experience, and then also with my community health education background I was able to connect with um, so I manage registered dietitians, clinical health educators, and our overall centers, so I can speak to what they're doing,
Mhm.
and help them innovate on what they're doing. That's what we're big on right now. Um, and so using the operational background to figure out, are we being fiscally responsible? How effective are we? How are we being productive with our time and our classes and our one-on-one appointments? So that's kind of where I'm sitting right now.
Okay. And if you had to give advice to someone that was starting out, that is going to start managing a team or managing people, what advice would you give them?
Mhm. So I would say for that, managing a team can seriously be, it doesn't have to be in healthcare. So if there's an opportunity entry level that you are like have a job opportunity to go work at the mall and go supervise people, that's management. Those skills on how to supervise people, that translates into healthcare because healthcare is a business. So if there's any way, like even volunteering, managing a team of volunteers for, I don't know, a breast cancer walk, that's management. So seeing opportunities that it doesn't have to be like this cookie cutter thing, but seeking opportunities, if you're in a current role and your current manager, um, asking for them, how do I develop into what role you are? Do you know of opportunities that I can tap into that are similar to you?
Okay, awesome. Thanks for sharing that. And before we move on to the next question, I just wanted to, I know you spoke a little bit about lean earlier, so some people might know what that is, they might not know. So can you just give us like a 30 seconds of what lean is?
Yes. Lean in my mind is, what is the problem we're trying to solve? And then there's different steps to get there. There's all these different toolbox. I think of lean as, the problem, and lean is reducing waste so that we can be more efficient in our workflows. As we know in healthcare, there's a lot of different ways we can be more productive and efficient. Lean is essentially your toolbox to solve the problem that you're trying to target.
Yeah, perfect example. And then I know before the show we spoke a little bit about you wanting to talk about how your fellowship catapulted your career. So I just wanted to give you like a little extra time to just talk about that. I know we did speak about like everything, but yeah, there you go.
Yeah, I think for me, like I said, kind of going back into the medical school route, I was 100% thinking I was going to go that way. But I encourage anyone, if it's a fellowship or an internship, to go in with open eyes, because it wasn't until I walked in those hospital floors, and I'd walked them before volunteering, but it wasn't until for some reason I went inside multiple of them while rounding, or and I kind of was feeling like uncomfortable. My gut check in that moment, I felt uncomfortable, and I said, if I'm going to be a doctor, I would want to jump in there. I would want to go in. And that's when I started to divert, and I said, I love looking at the systems. I love seeing how I can still indirectly impact these patients on a larger scale, maybe not on a one-to-one like all of the amazing providers do. But that is where the fellowship changed me, is that you use those opportunities as gut checks to yourself, as opportunities to open your own eyes into what excites you and what makes you uncomfortable. And not to say that discomfort is bad, because discomfort is growth, but I think that uh, I always say trust your gut because she knows what's up. So that was the biggest thing that the fellowship taught me, that and leadership, and really just taking care of myself, but moreover, do I want to impact individuals, or do I want to impact systems? And then that's where I landed. I want to impact systems.
Awesome. Thank you for sharing that. And that's kind of like the similar thought in my mind when I choose not to pursue medicine. It's like, oh, there's so much that you can do on the system side to improve population's health as opposed to doing that one-on-one. So moving on Instagram, you're at Jaennika.James, where you help millennial women in healthcare administration find fulfillment in their career. So why did you start this platform?
Yeah, I think it started with COVID. COVID. I think when I was just deep thick in it, March, April, my co-manager and I, she's also a young woman leader too, two kids. And the only way I felt like I was able to get through all of these changes together was our partnership and, talking to one another. And, I feel as though now more than ever, um, as I'm seeing it real time, so many people are retiring. All of the boomers, they're going. And us millennial leaders, it's our time. It's our time to rise up and show up. And it is very scary because healthcare is still very traditional and it has the very kind of traditional mindset. I think we're evolving there. We still have a lot of our, white male leaders in that. And I think that in order to be effective with our members we serve, that people like to see people and leaders who look like us, who talk like us. And this is where I want to connect women who are, on that brink of, you don't even have to be in healthcare admin if you're in healthcare in general, that we have our duty and our service to do as essential workers, and that we need to all come together during this time, connect, talk about how we're eating chocolate and how we can still be fine, or how are we moving, how are we speaking to ourselves, how are we still putting on makeup in the morning so we can show up for everybody, and that's really what I want to do. Is like, this is a very trying time for us, and the healthcare workforce is changing, and let's unite, let's combine, and there's work for you because you're essential.
Yeah, that is awesome. So what do you envision, or how do you go about helping women find fulfillment in their healthcare administration careers, I should ask?
Yeah. I think right now, because I'm just starting, I'm always just like, hey, DM me, whatever questions you have, or what your fears are, what you're looking into, what your pain points are. What does a lot of questions is like, what does a day in the life look like? How do you balance it? So I think for right now is like, I'm just reaching out to those who might be interested. I've been slowly starting like a monthly resource of whether it's taking a look at your education experience and exposure, or dusting off the resume. All of that is going to be driven by the community, or even just like fun ways to use TikTok and Reels to say, hey, if you're in healthcare admin, you can still dress cute and be excited to go to work. So I think that those small little things of just building that community, and then soon starting a podcast. It's very scary to share. But going into just sharing what the day to day is, and knowing that for me, I wish I had somebody just telling me, or just sharing what the experience is of how to navigate it, being a young woman leader in our industry, and to knock down that imposter syndrome, that you are exactly where you're meant to be, and called to.
Yeah, and I love that a lot. And thank you for the work that you're doing. And I feel like it's just important for all different aspects of public health, healthcare, to just be out there so people can see them, and they can see that there are diverse people like them doing these kinds of jobs. And there is a road out there that is not just medical school, that is not just being a doctor or a nurse, but there are so many other ways that you can help people out there. So definitely go and check out her Instagram page and look out for the podcast dropping next year. I look forward to it. Yeah, my pleasure, my pleasure. So, where would you like to see yourself in the future?
Mhm. You know, two things I was thinking of. COVID has really evolved, and even where I'm at, we're evolving. I on being in the base, some things I've toggled with is maybe going into a healthcare startup or technology to see how they are managing their pivoting in their business, what new ways are out there. Um, that's kind of the scary route, leaving my company that I've been with for 4 years to do something like that, or kind of going into, I would love to do like the director of like community health work or initiatives, total health. How can we, still make sure that we're addressing the resources of our communities?
Yeah, awesome. That's great. And I look forward to seeing you excel and to reach those heights and even further than what you see for yourself right now.
Thank you.
You're welcome. So moving you on to the last section of the show, the Furious Five, 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
hmm I would say be open. Grab a couple people who are doing what you feel like you would want to do. Follow you on Instagram because you share a lot of public health professions, and I think that that's the gap that I love that you're filling. Is there's the educators, there's the policy, there's administration, there's community health that you're doing. Is gather as much as information that you can, and sometimes it's information overload, but if there's an opportunity that comes to you, just go for it. And even if it's not the perfect one, just do it. There's learnings that you can find in anything.
Awesome. Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
I would say, um, if you'd love to get into healthcare leadership, definitely look at those organizations that you would want to be in as far as like leadership in. And, kind of stalk them and see what job opportunities are coming and apply. Um, or if you can't get in, as leadership, at least start somewhere there. Get your foot into the door, talk to people who are, currently in the role, and see if it's something that you want to do. Because, like I said, I found out early in the game, I don't want to do hospital operations. It's 24/7. It's a lot. Um, and so you don't know until you try. So that would be my biggest thing. Be bold and go out there and hustle.
Awesome. Number three, what's something you're working on improving in your life right now?
I think right now is really my mental health, especially right now, with COVID, and as a leader, it's a lot because you have yours that you're trying to deal with, and then everybody else's, and then your staff that you're managing. So how do you say no to things? Or yes, you still want to be social and be, go out there, but it's trying to find that the boundaries to make sure that you're good first. That's what I'm trying to work on. Make sure I'm good before I start trying to do all of the things, um, because you can't keep going if you're burnt out. Um, so just taking care of myself.
Yeah, absolutely. You can't pour from an empty cup. Um, Number four, professionally, do you recommend anything?
Yeah, so I love that question. So these are two books that, especially in for healthcare leadership, this is kind of Becoming the Boss, by Lindsay Polak, and it's talking about new rules for the next generation of leaders. Right, how to navigate when someone tells you, "Oh my God, you look like my daughter. My daughter's," So those things, because this is real. This is the new workforce, and then the first 90 days is also a really good one. I think it's always good. No, with having the growth mindset, you're always going to have a first 90 days in a new role. So even if it's a new role, it's always good to refresh yourself on what you should be doing in those first 90 days.
Some great recommendations, and I definitely have to add more books to my book list now, but thank you. I appreciate that. Number five, where can people connect with you?
Yeah, I would say you can find me at Jaennika.James. Or I haven't changed my last name yet on my LinkedIn, but Jaennika Anyag. I'm just a newlywed, so once I get that new card, I'll change it. But yeah, LinkedIn, or just DM me. I think DMing is probably the easiest way, and then we can chat from there.
Okay, awesome. Well, thank you so much for coming on the show and sharing your insights. I'm glad that we got our first healthcare administration person in here, and definitely reach out to Jaennika if you have any questions or you want to just need some help or want someone to talk to. Definitely, she is a resource.
Yay, thank you so much for having me, and I love what you're doing for this community, especially now. This is amazing, so thank you so much.
Yeah, my pleasure. Well, I'm glad that I got to have Jaennika on the show today. She dropped some great information. I love her story, and it's pretty similar to mine in some instances, which is kind of cool. But I'm really excited for her to be releasing her podcast next year, and I look forward to just getting more content from her side, just understanding more about healthcare administration, and I look forward to just collaborating and bouncing ideas off of her in the future. So if you have not subscribed to this episode as yet, if you have not subscribed to the show as yet, definitely go and subscribe, leave a review, like this video, share it with a friend, your mom, someone else, I don't know. But I appreciate you, and I hope you all are staying well. Until next time, take care. The Public Health Millennial out.